There's a saying, a healthy nation is a wealthy nation. Over the years, it is seen that the Nigerian budget only allocates a little percent of its overall budget to the health sector. The question is, will the 2017 budget aid the financial handicap of the health sector? Well, let's talk to some experts and hear what they have to say.
Healthcare is not something that you sit down and then look down at another sector. Even though they are villagers, you can learn something from them. We shouldn't allow what is traditional die off. Put it to standard, use that same system, and it will treat other people. Because internationally, Nigeria has 80% of what is in Africa when it comes to plants. And Africa has 80% of what is in the world. So that means only Nigeria can treat the world. So we have to catch up. By catching up means being able to make machines that will work with our own medical system. All we do is borrow machines from outside. So we need the funding to have special trained people who will generate that technology.
Health situation, if you want me to describe it, I would say challenging. Challenging in the sense that, for example, statistics shows that we lose about 2,300 children every day. We lose about 145 women of childbearing age every day. And also, if you go to some of our health facilities, the ones that are built up, you find out that there are no drugs, no key drugs required to, service those who come to the hospitals for treatment. And for some that have not been built up, you find out that you go to some communities, the nearest health facilities to them may be hours away. Assuming a woman wants to give birth and had to travel distances to get to a hospital or a primary health care center, you know what would have happened before you get there. So I would say the health sector in Nigeria is really challenging and requires urgent attention.
If we're going to be looking at the health sector in entirety and looking at the deficiency we have in the health sector, really I will be coming from the aspect of the health system over time. I'll be looking at this entire system, looking about the people, the institutions, the policies, the entire health system has not really been strengthened enough to be able to deliver on the needed health outcomes we want to. So there is need for the government to work around reforming the entire system to making it stronger. You need to ensure that the sixth block of the health system is well in place. We're looking at the government needs to ensure that the human resource for health is adequate to deliver on quality health services. We're looking at service delivery in terms of affordability, access. That aspect needs to be well strengthened. We are looking at the governance, the leadership aspect of it. We're also looking at the health financing component. So all the strata of the six building block for the health system needs to be they need to be strengthened.
Reports have it that the Senate have proposed an increase in the funds allocated to the health sector contained in the proposed 2017 budget submitted by President Muhammadu Buhari to 1.1 trillion naira as opposed to the initial 304 billion naira, which was considered inadequate to meet the World Health Organization's recommendation of 13% or the African Union countries' declaration of 15%. Health experts from a non-governmental agency with the mission of ensuring perfect release and implementation of health sector funds, Partnership for Advocacy in Child and Family Health Care, PACFA, recommended areas in the sector that should be better funded.
The indicators we're having in the country related to maternal, that's women, and also child health, we are still recording a lot of women dying in pregnancy, delivery, and also period. That's the first 6 weeks after pregnancy. And we are still also witnessing children dying before the age of 50 years due to a lot of communicable diseases that immunization can actually address. So the budget for the 2017 should be allocated more to see that the women and children survive. So in the area of immunization, there should be adequate money, and not only money from the international partners, procuring vaccine, but Nigerian government should also allocate money for immunization. We also need to see that apart from immunization, the children that they are sick, they come to hospital, so there are adequate life-saving drugs, not for children and women.
It is no longer news that the Nigerian health sector has suffered a lot of challenges despite reforms put in place by the government. From our research, it is opined by many Nigerians that better funding of the health sector will greatly improve the health sector. I am Pam Mafen reporting for ISWB TV.